Hi, this is Andrea, and we are now on week 3 already of HSC 114 medical terminology. And this week we're going to be looking at the nervous system and the psychiatric system or psychiatry. We're going to start, this video is about the nervous system. It is chapter 10 in your book, again, week 3. And if you look at your syllabus, we are on unit 6 for this one. And our objectives are listed here on the slide, but they are also listed under unit 6 in your syllabus. So if you have any questions about what we're going to be learning and why we're going to be learning it this week, refer back to those. And as usual, we're going to be looking at things that are associated with the nervous system and understanding how this works in the context. So let's dive in. Our nervous system is very complex. There are over 10 billion nerve cells in our bodies. There are voluntary nerves and involuntary nerves. So make sure that you're aware of those two different functions. And what's the difference between those two, because you'll need to know that. They carry electrical messages, and they have internal and external receptors. The cells themselves are called neurons. They are microscopic, and they are collected into macroscopic nerves. They carry those messages all over our bodies. There are two major divisions in the nervous system. The first one is your central nervous system, CNS. Your CNS has your brain and spinal cord. Those are the major ones. The other one is your peripheral nervous system, which is PNS. So again, remember you've got those two main divisions when you're studying this week, CNS and PNS. CNS is brain and spinal cord. Everything else is going to fall into that PNS system, your cranial nerves, spinal nerves, plexuses, and peripheral nerves throughout the body. So if you can kind of remember, your central nervous system is your brain and spinal cord, and everything else is your peripheral nervous system, that will really help you. So let's talk about those cranial and spinal nerves. They are sensory nerves that carry messages toward the brain. There are motor nerves that carry messages from the brain, and there are mixed nerves that carry them both, sensory and motor. So sensory, again, is taking them from somewhere to the brain. Motor nerves are carrying them away from the brain. A good way to think about this is your senses take in messages that your brain translates. And then once your brain translates those sensory messages, then they command motor nerves, which are like your muscles and things, to respond. So sensory is you pick it up like through your fingertips, think of that, and it runs all the way through to your brain translates it, and then your brain sends back this message of this is what you must do, this is how you must react, this is what you want to do next. Think of that as motor. It's sending you directions on where to go and how to get there. So sensory is from your fingertips to your brain, and motor is from your brain back out, telling you what to do, where to go, how to do it, all those types of things. If we're talking about mixed nerves, they have both kinds of fibers, and they can send both kinds of messages. So those are the three types. Your sensory receptors, this is where we get into autonomic and parasympathetic. So you're going to be learning about that as well. Your autonomic, remember auto is self. So these autonomic nerve cells will carry impulses from your central nervous system, which again is your brain and spinal cord, to the organs. Sympathetic nerves then stimulate the body under stress. Parasympathetic balance that. So sympathetic is you're responding to what's out there. You're feeling it. You're feeling those emotions. Parasympathetic is your response to those emotions, your response to the sympathy. So think about that. So your natural fight or flight tendencies, those are sympathetic nerves. Your brain saying, calm down, let's think through this, let's not panic, what can we do? That's your parasympathetic nerves. So those are ways for you to think about that. And here's a really good visual for you. For those of us who like to look at visuals and kind of break it down that way, this helps you. So again, your central nervous system is your brain and spinal cord. Your peripheral nervous system has cranial nerves, Then you have spinal nerves, and then you have autonomic nerves, and those autonomic nerves are your sympathetic and parasympathetic. And sympathetic, again, fight or flight, and parasympathetic is calm down, let's get through this, let's think about how we should be reacting, those types of things. Neurons. We're going to get into the neurons, nerves, and glia. I'm not going to talk a whole lot about this in these slides, so make sure you take a look in your book about this. Neuron is an individual nerve cell. It'll get you through the different pieces and parts. I know that in one of our discussions in week 2, someone mentioned MS, and which is multiple sclerosis, and that has to do with the myelin sheath. So if you're interested in studying more about MS, multiple sclerosis, you'll learn about nerve cells and about how they impact that myelin sheath. Just a little FYI in there. And then talks about the end fibers, the terminal end fibers, and the neurotransmitters, and all of that. And there's chemical reactions between the nerves that pass information. You'll get into all that as well. Ganglia are those small clusters of nerve cell bodies. And so the parts of a neuron: dendrites, cell body, cell nucleus, axon, myelin sheath, terminal end fibers, and synapse. And this is another really good visual. Sometimes it's hard to think about how nerves interact with each other, because sometimes they touch and sometimes they don't. Well, how does that message get passed from nerve fiber to nerve fiber if there is no direct connection? And this is a really good visual to talk about the neurotransmitters that are a chemical that go in between the two and keep the message going. All right. Moving on to glia cells. They maintain the health of the nervous system. They do not transmit impulses. So make sure you remember that your glia cells are not transmitting impulses. You have 4 types. You have astrocytes, microglia, oligodendroglia, and ependymal cells. And this shows you what each one looks like. They're a little bit different. As you can imagine, they all have a little bit of a different function to them. So I'm going to let you take a look in your book about those, but make sure that you understand what those 4 are and how to spell them. Hopefully they won't be on a test or a quiz, but in an off chance that they are, make sure that you have at least spelled them several times to yourself and can recognize them. So let's dive into the brain. What are the anatomical structures of the brain? It's frontal lobe, the sulci, the gyri, parietal lobe, occipital lobe, Wernicke area, temporal lobe, and Broca area. And this gives you an idea, another visual of where everything is and kind of what it does. What is its function? You have your frontal lobe, parietal lobe, occipital lobe, temporal lobe, and then we will get into the brainstem and all of that later. But your frontal lobe is where your thought processes are, where your behavior activities take place, personality, emotion. That's why people who have traumatic brain injuries in the frontal lobe often have challenges afterwards with those types of things. The parietal lobe is your sensations, your visual, your ability to tell space. For some of you, being able to see depth perception, that type of thing is very easy. For others of us, it's a bit challenging. When I parallel park, I always have trouble with depth perception, and so I tend to leave a lot of space in front of my car and behind my car when I parallel park. That's a good example of where I'm challenged with my depth perception, and that's in my parietal lobe. And I like to blame that on a concussion I had as a child, but who knows? Your occipital lobe has to do with your vision. And that's why people who have head injuries in the back may have trouble with their vision. Then you've got your temporal lobe, hearing, understanding speech, language. A lot of times you'll hear about people who have had a stroke and it's impacted their temporal lobe and they have trouble speaking. They have dysphagia as a sequela or as a result of the stroke that stays with them after the stroke. And so they have to have speech language pathology assistance. So just be aware of these. Your cerebrum is the largest section of your brain. It has a surface nerve cells called the cerebral cortex. It manages your speech, vision, smell, movement, hearing, and thought. Your cerebellum coordinates your voluntary movements. It maintains your balance. Sometimes people who get a tumor in their cerebellum, one of the easiest ways to notice that they've got something going on there is their voluntary movements become difficult to control, or they have issues with maintaining balance. Your thalamus integrates and monitors those impulses from your skin, which is pain related. There's a lot of research going on about your thalamus and how to manage that. As we look to move away from opioid pain medicines, there's a lot of research going on in that direction. Hypothalamus, it controls your body temp, your sleep, appetite, sexual desire, and emotions. It regulates release of hormones from that old pituitary gland that we'll be talking about, monitors your sympathetic and parasympathetic nervous systems. Remember, sympathetic is fight or flight, and parasympathetic is calm down, calm down. Let's think about this. Let's handle those activities in our body that have raised our heart rate or have our mind just flying along paths. So that's all of what that does. Brainstem. There's a part of your brainstem called the pons. It bridges the cerebrum. I'm having trouble talking today. Sorry about that. Cerebrum and the cerebellum with the rest of the brain. It houses nerves for the face and the eyes. The midbrain is in there, the uppermost portion of the brainstem, and it has pathways that connect the cerebrum with the lower portions of the brain. Your medulla oblongata. Medulla oblongata. Ooh, what a long Latin word that is. Make sure you can spell it, because at some point you'll probably need to. It is what connects your spinal cord to the brain and your nerve tracks from side to side. It regulates your blood vessels, your heart, and your respiratory system. So it is very important. This is a cross-section of the spinal cord. It gives you a chance to see the different types of matter, posterior shape versus the anterior shape. Remember, anterior is your front, posterior is your back. So your anterior is facing your neck in the front, and the posterior is facing your neck in the back. And that just gives you an idea of a cross-section. The central canal is in there. And you can see spinal nerves and all sorts of other stuff. So what are your meninges? They contain your dura mater, subdural space, arachnoid membrane. Arachnoid is not meant to be spider, but we think of arachnia, those types of things as spider, but it's a membrane. Subarachnoid space and your pia mater. Mater is the word for mother in Latin, so that may help you remember this. Here is a cross-section, well, more of a back to front slice of your head. This is looking at what it would be like if someone cut your head in half instead of from the top to the bottom, from front to back, so that we're looking from back to front in this picture. You can see the different layers of the scalp, the cranium, the dura mater, subdural space, arachnoid membrane, the subarachnoid space that has the cerebrospinal fluid in it, the pia mater, and then you can see how all that works together and leads down to the spinal cord. So now we're into vocabulary. Lots and lots of vocabulary. I should have warned you when we started that this was going to be a long lecture. There's 88 slides and we're only on slide 28. So if you need to stop to take a break, feel free to pause at any time, because it's going to take me a while to get through this. Acetylcholine, afferent nerve, arachnoid membrane. Those are the terms here at the beginning, and here are your meanings and definitions. Acetylcholine, that's something that you would need to know. I know it's a long word, but it is a very important neurotransmitter chemical that is there between nerve cells and carries those messages. And some more terms and meanings and definitions. Cauda equina. Equine is the Latin word for horse. Um, some people call this like horse's tail. It reminds them of horse's tail. But cauda equina is a collection of spinal nerves below the end of the spinal cord. So if you think of it as sort of the tail end of your spinal cord, it's like a horse's tail. It's those nerves there at the end. That may help you remember it. And here are more. We talked through a lot of these already. Make sure you know the difference between the central nervous system and the peripheral nervous system. We didn't talk a lot about cerebrospinal fluid. It circulates throughout the brain and the spinal cord, and it's really important that that not come out. One of the worst indications that someone has a severe brain injury is if there's cerebrospinal fluid leaking from their ears. That's really, really, really a bad sign. Um, the other thing is that we withdraw cerebrospinal fluid for a lumbar puncture. Sometimes to see if someone has meningitis, they'll do what's called a lumbar puncture. They'll put in a needle between your lumbar spine into the spinal cord area. It doesn't touch the spinal cord. Heavens no, it should never touch the spinal cord, but into that area to withdraw some of that fluid, which is then sent to pathology, and they run tests on it to see if there are any bacteria in there to diagnose something like meningitis. You have 12 pairs of cranial nerves. That's why we feel and know so much, as we have so many cranial nerves going on. Another word for motor nerve is efferent nerve. Motor nerve, efferent nerve. So you're going to want to remember that. And notice, again, our good old Latin comes back to us with ganglion as the singular and ganglia as plural. And we'll see that with gyrus and gyri. You've probably heard of the meninges. I just mentioned meningitis a few slides ago. Meningitis means inflammation of the meninges, and those are the protective membranes that surround the brain and spinal cord. Typically, if you have meningitis and inflammation of the meninges, there's something infectious going on there, and usually, more often than not, it's bacterial rather than viral, although it can be viral. So don't rule that out. And I talked a little bit about the myelin sheath earlier when we were talking about MS, multiple sclerosis. And you can imagine that if that covering gets stripped off or damaged or destroyed, it slows down the impulse conduction. And what happens if your impulse conduction of that is slowed down? How does that impact? So think about that if you happen to do any research on multiple sclerosis. And a good point about neurotransmitters is not only do they carry the message, but they can stimulate or encourage another cell, or they can inhibit or discourage another cell. So it's sort of like not just carrying a message, but actually carrying out the message, telling the other cell, you will do this or you will not do this. Sort of like a parent telling a child, you will clean your room or you will not clean your room or else. But they actually enforce that by the chemical. We talked about your parasympathetic nerves versus your sympathetic nerves. Your sympathetic nerves are getting your body going, fight, flight, immediate. We got to do something. We've got to do it now. We've got to move. And your parasympathetic balance that by saying, okay, let's calm down. Let's start and think about this. Let's settle your tummy. Let's slow down your breathing. Let's slow down your heart rate. No hyperventilating. No immediate response of getting sick. It's where it's trying to soothe you down and soothe those muscles in your body that are they're parasympathetic to your sympathetic nerves, shall we say. Another Latin term, plexus, and that's the singular. Plexuses is your plural. And I don't know why it's that, but it is. Your pons is the part of the brain that is anterior, which means in front of the cerebellum and between the medulla and the rest of the midbrain. Have you ever heard of sciatica? It involves your sciatic nerve. That's the nerve that extends from the base of the spine down your thigh and lower leg and foot, and can sometimes, if you get sciatica, it means that maybe you've got a pinched nerve and it's causing maybe pain. It could be, or a sense of tingling, those types of things. Oh, let me go back really quick. The sensory nerve, it carries messages toward the brain and spinal cord from the receptor. It's an afferent. Instead of efferent, it's afferent. It's toward. Remember those? We talked about that earlier. Stimulus is singular. Stimuli is plural. It's like syllabus and syllabi. And you have 31 pairs of spinal nerves. It's a lot. And when you think about those pairs of nerves, you can see why spinal injuries can have a significant impact on the nerves. Sulcus is singular, sulci is plural. It's depression or groove in the surface of the cerebral cortex, fissure or fissures. And let's see. Vagus nerve, that's a really interesting one. It's your 10th cranial nerve. It branches out to the larynx, trachea, bronchi, lungs, aorta, esophagus, and stomach. And there have been nerve stimulators developed for the vagal nerve and implanted to control it or help it behave the way that it's supposed to. So that might be an area that if you're interested in, you can research as a vagal nerve stimulator. The ventricles of your brain are canals that have cerebrospinal fluid in them. So here's a quiz. And I'm going to let you go back and take a look at that. You may need to do a bit of review because I didn't really touch on the answer to this one very much. The thin, delicate inner membrane of the meninges. You might have to go back and look at that too. So here we get to our combining forms. And I'm just going to fly through these. I'll point out anything exceptional, but again, notice that most of them have the combining vowel of O. So your combining root plus your combining vowel equals your combining form. And that's what you have on the left here, and then on the right is the meaning. Watch out for meningo or meningio. They both mean membranes, meninges, but you need to be aware that that I may be in some versus others. Watch out for myo, which is muscle, versus myelo, which is spinal cord. Now, did you notice here, theek means sheath, but it refers to the meninges. Well, we just had meningio on the previous slide, so going back here to theek, watch out for that. Make sure you're aware of those. Here's an interesting one. Algese/O is the combining form. Algesia is the suffix. So you could have a combining form or a suffix that means very sensitive to pain. And same thing with aesthesio or aesthesia and kinesio or kineso and kinesia. So watch out for that because you could very well have, and algia is pain, algesia is sensitivity to pain. So you've got some that kind of overlap here, and as you're doing your flashcards and studying and whatnot, make sure that you get those straight because they're very similar. Kinesis, kinetic, it's all about movement. So which term means nerve pain? Pain. Think about that. So not sensitivity to pain, but pain. And this is important here. There's a type of hematoma that occurs between the skull and the dura. So make sure that you are aware of the different parts, the different layers. From an anatomy standpoint, you need to know the different layers. All right, so let's talk about pathology. And we'll start with congenital disorders. Hydrocephalus, that and spinal bifida. Those are two good ones to take a look at for congenital disorders that have to do with the spinal cord or the brain. These are degenerative movement and seizure disorders. Alzheimer's, amyotrophic lateral sclerosis. You might know this as Lou Gehrig's disease. He was a famous baseball player, and he developed amyotrophic lateral sclerosis. And this is another one of those diseases that unfortunately, even though they've done a lot of research on, it is eventually fatal. The question is, how much time can you delay to give someone who has ALS? So if you were thinking about researching something, Lou Gehrig's disease or amyotrophic lateral sclerosis is a good one to research. Lots of interesting information in what they're trying to do to try and slow its progression and eventually, hopefully, reverse it or cure it or prevent it. Then, of course, there's epilepsy. A lot of people with epilepsy now have service animals, like a service dog, that alerts them before they're going to have a seizure. Because not all epilepsy can be managed with medication. A lot of it can, but still there are times when those seizures, they're going to have a breakthrough seizure, those types of things. And now there are service dogs that can alert them so that they can be in a safe place or have someone around them that can help them when they're going to have a seizure. Huntington disease, MS, I talked a little bit about. I have a really good friend who has MS and has had it for probably 25 years. And so I've seen some of her challenges going through that and learned a lot about it when she was diagnosed, on ways to support her, encourage her, things that she would run into, and what she would have in terms of a prognosis and life experience through that disease. So really encourage you that if you have somebody in your life who develops something, go research it and spend some time with them and encourage them, um, and help them with what they're doing. Myasthenia gravis, that's usually more like Alzheimer's, of something that happens as you get older. There are different types of palsy. You may have heard of Bell's palsy, which is a temporary palsy that usually reverses itself, but it can take several months. You can also have tremors. Um, that's sort of a type of palsy, not necessarily, but it's similar. Parkinson's disease. We've learned a lot about Parkinson's disease because there's been a lot of celebrities who have developed that over the years. You think about Muhammad Ali has had that. You think about Michael J. Fox and others who have really brought forward some of the challenges of Parkinson's disease and the research that they're doing to try and reverse it, stop it, slow it down, eliminate it. There's Tourette syndrome. There's also infectious disorders. Herpes zoster can cause shingles. And shingles are a very painful disease that impact the nerves and the nervous system. For those of you who have older grandparents, great-grandparents, sometimes they develop shingles, and that has an association with stress. It can have an association with an infection, those types of things. And then I talked a little bit about meningitis. And that's a really good one to research as well. And then we didn't spend much time on HIV, human immunodeficiency virus. Part of HIV is that some people can develop encephalopathy. HIV means that someone has that virus. It doesn't necessarily mean that they have AIDS. AIDS is not diagnosed until they've actually had some kind of medical condition that results from the HIV virus. So just because someone is HIV positive does not mean that they have AIDS. They're not diagnosed as having AIDS until they've had something like HIV encephalopathy, or there's a number of other things that they could have. Traumatic disorders. Concussions. You can have a concussion. It's usually from a blow to the head. No evidence of structural damage to brain tissue. You need rest. We hear a lot about concussions now with sports injuries. When I was young, I got mine from falling backwards off a horse while I was riding down an asphalt road. Someone startled my horse and it reared up, and I wasn't prepared for it and fell off backwards and slammed the back of my head into the road. So there is hope. You can recover. So far, I don't seem to have any structural damage. But you hear about the damage that repeated concussions have had on professional players in, such as the football league or hockey, or something where they've had it happen several times. Lesser trauma than a concussion is a contusion, where you've bruised it, and a lot of times you'll hear a bruising referred to as a hematoma or along the lines. The unfortunate part is when you get that can actually that can actually lead to permanent brain injury. So concussion and contusions, bad things. Cerebrovascular accidents. Cerebrovascular accidents are strokes. That's how we have heard of them named in layman's terms as stroke, but it's really a cerebrovascular accident, a CVA. There are different types. There are 3 types. Thrombotic, which is a blood clot. Embolic, which means that blood clot traveled. And hemorrhagic, where a blood vessel broke and bleeding occurred. This is a really good visual for thinking about how a cerebrovascular accident could have happened. You've got blood flowing normally through an artery. It's just going along, it's doing its thing. Embolic is when you've got that clot and it occludes. It makes it so that the blood can't get through. So it stops the blood from flowing. It keeps it from getting where it needs to be, and that can cause an embolic stroke. Then you have hemorrhagic, which is where the artery wall itself ruptures for a number of reasons. It could be, it could just be pressure. It could be thinning of the wall for some strange reason, but you actually have bleeding outside that wall. Those are very bad. Definitely don't want one of those. Thrombotic strokes are those plaques. If you've ever heard of somebody having arteriosclerotic type of a situation, that's where you are building up plaque in your arteries, and eventually it slows down the blood flow to the point where it's not quite an embolic situation, but maybe it's very close to embolic. And so it builds up, builds up, builds up. With an embolic, that's a clot. You break up the clot, the blood keeps flowing. Thrombotic, you actually have to sort of dig it out. And that's where you get into like heart catheterizations, where they go in and they clean out those arteries and end up putting in a stent to hold it open. So what are some clinical procedures that you might see with the nervous system? There's x-ray tests, and there's MRIs, PET scans, and EEG. A lot of times you'll hear about people doing an EEG, electroencephalogram, or electroencephalography. Got to spit it out there, sorry. An EEG is often done to look at your brain function, to see if you still have brain waves and are they functioning. They do that a lot of times to see if someone who is on a ventilator, if they're going to be able to recover, because someone who doesn't have any brain waves or whose brain waves are flat, they're not moving, with an EEG, they're technically brain dead. And that's when a lot of times they'll say, we need to think about taking this person off the respirator. So an EEG is something you definitely would hear about. And then you got Doppler ultrasound studies. Abbreviations. Oh, lots and lots and lots of abbreviations. And I'm not going to really spend a whole lot of time on these. You just really need to make yourself some of those handy dandy flashcards and go through them. Has anybody ever heard of a TENS unit? A transcutaneous electrical nerve stimulation. TENS units are often used in physical therapy to relieve pain and to stimulate a muscle, those types of things. So you may have heard of a TENS unit, T-E-N-S unit. You may also have heard of TPA at the bottom of this slide, tissue plasminogen activator. If someone has a stroke and they are able to be brought to the hospital quickly within a matter of an hour or so, or a couple of hours within when they notice the stroke happening. They can give them TPA and it will destroy that clot. And many patients who receive TPA in a timely manner, they end up with no residual problems from that stroke. They don't have the difficulty swallowing, difficulty speaking. They don't have the limbs that are weak or aren't responding, those types of things. So TPA is really important. All right, practical applications. What symptoms signal nervous system problems? Well, we kind of talk through this depending on the different ones. But think about that. Think about the function of your nerves, and then think about how that would clue you in that there's something going on with your nervous system. What tests did we talk about that are conducted to diagnose these problems? Why might an MRI and an MRA be ordered? We just finished studying radiology, so you might need to pop back to week 2 and take a look at that. What are some common pathologies of the nervous system? We talked about several of those as well. So we're finishing up. We're on the home stretch here, just a couple more slides. These again go through your combining forms, which are your combining root plus your combining vowel equals your combining form. And I think we went through pretty much all of these earlier in the slides, but they must really want to make sure that you know them because they put them in again. All right, that's it. I'm going to end the video here, and when I come back, we'll be on week 3 looking at psychiatry. So take it easy, and be back to talk to you again soon.